Hello everyone, I'm Kibin Alleyne and today is Tuesday, July 2nd. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. SBH Health System in the Bronx unveiled a brand new medical psychiatry unit. The specialized unit treats vulnerable patients facing both acute medical illnesses and mental health issues. The new unit is a significant development as the Bronx experiences the highest rate of psychiatric hospitalizations of all 5 boroughs. Dr. Lizica Troneci, chair of the Department of the Psychiatry unit at SBH Health System, joins me in discussing this new development. Doctor, thank you so much for joining me.
Thank you for having me.
Now, I'd really love to know, we talked a little bit about, just mental health in the Bronx, but can you further discuss what sparked the creation of this brand new medical psychiatry unit at SBH?
The creation of such a unit was sparked or generated by our community needs, by the experience of providers at SBH Health System, and not only, I should say, in the healthcare system in general. So about 2 years ago, we learned more about the medical psychiatric concept or model of care. And I would say a year ago, we visited a hospital, it's Rochester Memorial Hospital in Rochester, New York. They opened such a unit a few years ago. The SBH's medical psychiatric unit is actually the first one in the Bronx and the only one. And it opened last week on Thursday.
Wow. Now, I'm curious to know, can you tell us a little bit more about how the unit will serve, this vulnerable population? And, you mentioned it's the first one, which I think it's, just given the statistics that are here in the Bronx, I think it's very important. So can you just explain, how the unit will further just overall benefit the community?
The community of patients in the South Bronx have a high rate of mental illness and medical illness. Coupled with many what we now call social determinants of health, homelessness, unemployment, legal history, substance use, and I can go on with this. So they need tighter services, wraparound services to meet their needs. The experience has shown, and the healthcare system experience has shown that cohorting the patients in this space of the medical psychiatric unit ensures more efficient and timely management of both their medical and mental health conditions. It really coordinates care and ensures that they get discharged from the hospital with the services they need. The medical psychiatric unit is located on one of the medical units at SBH Health System, has 8-bed capacity, has a co-management model where the medical team retains the capacity of being the primary provider and the psychiatry team remains the consultant. But psychiatry takes a more active role in co-managing these patients. Also, we have recruited nursing staff with not only medical skills but psychiatric skills or interest in working with this patient population. And there is a social worker. The social worker has also background in the medical and the psychiatric behavioral health system, I should say. There are multidisciplinary rounds every morning where patients are discussed, their management plans are developed and implemented. It just ensures a smoother process, and we know that communication can be the culprit or many problems in general. So the tighter communication really enhances the services we provide.
Now, you mentioned social workers, which I think is so important, and I was really kind of glad to hear because, when we think of health and, just the world of health and just the medical system, it's very like doctor-patient, a lot of facts, but to hear that there's social workers there, maybe to kind of touch on the emotion or, just maybe what these patients are going through. Can you talk about the importance of the presence of a social worker in this type of work?
Sure. Social workers have several roles, I should say. They perform an assessment of the patient's not only social determinants of health, and I'll keep using this wording, I should say. Where does the patient live? How do they, does the patient support himself, herself? Do they have any family support? But they also provide therapy and education to patients and families. Having a social worker as part of the team on the medical psychiatric unit will also promote having family meetings, which are so important, including family or / providers meetings, I should say. The people who are invested and interested in that patient's, in that individual's well-being.
Now, you mentioned that you're going to keep saying social determinants of health, and it is very important considering that the Bronx experiences the highest rate of psychiatric hospitalizations of all the 5 boroughs. How are we seeing social determinants play out in regard to the Bronx?
The Bronx, St. Barnabas Health System is located in the Bronx, and the Bronx is the poorest urban congregational district. So the community is confronted with many stressors. I've mentioned them already: homelessness, unemployment, the rate of poverty, as I mentioned, legal history, criminalization of behaviors, and all of these contribute to the management of medical and mental health conditions. Because when a patient is home or an individual is homeless, the property gets stolen, the medication gets stolen, and that's how that patient ends up in the emergency room or being hospitalized a few days later.
Now, I understand there's something called the multidisciplinary management approach. Can you tell me a little bit more about that approach and how does it assist in addressing mental health challenges?
The multidisciplinary model we employ in the medical psychiatric unit has really all the disciplines wrapped around the patient and the patient's needs. The medical team will manage the medical condition. The psychiatric team will do the same for the mental health condition. And nursing provides education. A patient with diabetes, might need education on how to administer insulin or how to check their blood sugar. And the social worker assesses the individual's needs and provides services. The medical psychiatric unit having this team, which is a consistent team, I think this is going to be part of the success of the unit. It's a consistent team of providers. So we're not going to have to lose any information during the handoff process from one doctor to another or from a social worker to another. This has proven to be successful on the inpatient psychiatric units.
Now, can you tell me a little bit more about how this effort is supported by Fidelis Care?
Yes. The collaboration with Fidelis Care came under an initiative of the Office of Mental Health, which is called Behavioral Health Centers of Excellence, which was developed and implemented in the summer of 2023, actually. This initiative promotes and funds projects involving Medicaid managed care organizations. Fidelis Care is one of them, and healthcare providers. SBH Health System is one of them. The first fiscal year provided $100 million. We received a part of this, and we received it actually from Fidelis Care. So Fidelis Care is the one that receives the funds directly from the Office of Mental Health.
Now, considering mental health, could you just talk about how community members, because this is a public health a public health challenge that we're facing, how can community members avoid contributing to the stigma that is placed on those who are, experiencing mental health challenges?
We know education is paramount. Education through school, we provide education in schools for children, for teachers. We provide education in community organizations, in churches, for example. But there is a stigma in the healthcare system, and the medical psychiatric unit lessens the stigma associated with having to treat mentally ill patient for a medical condition somewhere in the hospital. So we're hoping that, again, this medical psychiatric unit model will train and educate students, medical students, residents, and by doing so, nursing students, right? And by doing so, will promote and enhance education and make all of us more accepting of working and treating mentally ill patients.
And as we mentioned previously, again, this is like the first of its kind in the community. What do you hope to see, because you're stationed in the Bronx and supporting the Bronx community, what do you hope to see for, just medical systems in general throughout this borough and possibly even New York City? What do you hope to see them, or how do you hope to see them grow in regard to, challenges with mental health that our city is facing?
We hope that this model that we've implemented, which is not new, it was developed worldwide in the 1980s and in the United States at early 2000. There are few other medical psychiatric units in the city, and there is a medical psychiatric consortium which provides education to healthcare systems and providers interested in promoting this model. So we hope that outcomes, the successes we accomplish, can be promoted and be distributed to other communities and other institutions, and by doing so, we hope to help not only our community but other communities and mental illness ultimately.
Doctor, thank you so much for joining us and having this very important conversation. It's glad to see what your institution is doing to help better our community. So once again, thank you for joining us.
Sure. Thank you for having me.
To find out more about the work SBH Health System does, please go to their website at sbhny.org. Don't go away. We'll be back with more Open right after this.